Hello everyone, I am Jay Kumar, faculty in physiotherapy from NIPMAT, National Institute for Empowerment of Persons with Multiple Disabilities. It's located in ECR, Chennai. I have in this video about a part of a pulmonary rehabilitation series of videos. So this will be dealing with a prevailing situation where COVID-19 affected patients and then the survivors who are still with the persistent or residual symptoms. Most of the symptoms is difficulty in coughing out the secretions of the lung, and then we will be having a difficulty in breathing. So here we are going to have a learn about a technique that is going to increase the amount of secretions spitting out by the patient, and then without any tiredness or without any pain around the, because the continuous coughing during this period, what happens is most of the patient complain of chest pain, pain around this area, pain around the chest area, and tenderness. When they touch, they will feel the pain around that area. They will be having a difficult to spit out the sputum because of the tired or fatigued muscles, tired muscles in around this area. So thinking about the pain itself, they will be reduce the intention of voluntarily spitting out the sputum to cough. So this technique will have a serious step-by-step process. We have to learn this technique so that efficiently we can breathe in without any breathlessness and then cough out the secretions of the lung. So first, this will be having a relaxed breathing phase. A relaxed breathing phase is you will be breathing on your own at your own pace. So this will help you to check it out at what level you are able to breathe in and the breathe out. Okay. Next will be the chest mobility exercises. What will be the exercises? So due to the continuous position lying in the bed or sitting in the chair or in different positions, what happens is during this, the lungs will be expanding of the lungs will be very much reduced. Because of that, what happens is the number of air or the volume of air inside the lungs also will be reduced. So exchange of gases will be less, your saturation will be less, and then your recovery of your muscles will be less, so that the muscles gets tired and it's difficult for you to cough and then spit out the secretions of the lungs. So next will be the mobilization exercise for your chest. So what you will be doing is you try to mobilize this area. So simple exercise will be place your hand behind your back. So take it as back as back. Take your elbows as back as you could, and then so I'm going to turn and show you that how would be this. So take it back as far as you could. Breathe in, breathe out, breathe in, breathe out. Take a deep breath. Breathe out. Breathe in, breathe out. Breathe in, breathe out. So you have to repeat it 4 or 5 times as tolerated by you. And then as the day progresses, the number of movements has to increase. So for example, if you are able to do 4 or 5 movements, then by the end of 4 or 5 days, you will be able to do 10 movements of this is for an example. This can be done as tolerated by the person. Okay. So this will be moving this all the bones and then help you moving the secretions inside the lungs. This will be followed by a breath hold phase where you will be taking a air. So this will be having 3 levels. So depending upon initially the patient having very much difficulty, then you can have it the low volume, mid volume, high volume. Or the same patients initially will be doing it the first time will be doing the mid volume, second time will be doing it low volume, second time will be doing the mid volume, and the third time will be doing the high volume. So what is this low volume, mid volume? Is the amount of air you breathe in. Okay, so this will be a small amount of air, especially the mid volume is little bit more than the low volume. So deep breathing, larger volume will be like taking the Have to expand the lungs as much as you could. Imagine a balloon. Okay, so when you're taking air, the lungs has to expand like a balloon. Okay, so now what you are going to do is take low volumes of air as a first. Hold it, breathe in, hold it, 4 counts 1, 2, 3, 4, 5 for the start, and then breathe out like a whistling. So you are not going to breathe out as fast as you are breathing. Okay, so you are going to breathe out in a slow pace. Breathe in and breathe out like you are whistling. So don't let out air with the short duration of time. As the day progresses, as you master this technique, you have to increase the breathing in time and then increase the breathe out time. So the duration of breathing in has to increase and the duration of breathe out has to increase, and the duration of the hold also has to increase. This will mobilize the secretions, this will expand your lung. Okay, so that once this process here, this is called as setting up for coughing the secretions out. So due to this reduced breathlessness, as we said, they will be tired. So that will be easily resolved with this one. Without any tiredness, taking in enough amount of oxygen, they can easily sort out the amount of sputum to cough. So next we will be doing the coughing or the forced expiratory phase or the forced spitting of the. So for that you will have initially one technique called as coughing, where you will be taking in air deep inside and then will be blowing out with the open mouth and making a sound. Okay, so then doing this you will try to stuck in your stomach inside. Okay, so this will mobilize the secretions all around from the edges of the lungs and tries to move towards the lung. Okay, like this. So we'll be doing the low volumes, then we'll be doing the mid volumes. Then we'll be doing the high volumes. Okay. So like this, we will be doing the different volumes so that the stubborn secretions inside the edges of your lungs will be try to move inside the lungs. Then what we will do once the lungs comes inside this phase, then we will not be cough out that. We take in small amount of air and then blow out with the sound making air. So in coughing, you will be doing it with the relaxed throat. In coughing, you will be doing it with the closed throat. Okay. So in cough, you will do is you make this part tight and so you will be coughing it with the ka sound. In coughing, you will be doing it in the sound. So this will move the secretions here. Once this is come here, we will do the normal coughing. So this will try to take the sputum out easily. So by doing this, you won't be getting tired. You can efficiently you will be moving the secretions by this way that it will increase your saturation levels and then increase your progression from your disease, and you will be getting into that will be moving into the normal phase as early as. So this exercise will help you in achieving more efficient breathing and coughing. So wait out for the more videos from our institute.